The COVID-19 pandemic has left behind not only respiratory challenges but also a silent yet significant cardiac impact that continues to emerge even after recovery, making it essential for everyone who has battled this virus, whether mildly or severely, to understand its lingering effects on the heart. Recent studies have shown that SARS-CoV-2, the virus responsible for COVID-19, does not limit its attack to the lungs alone, but can directly invade heart muscle cells through ACE2 receptors, triggering inflammation known as myocarditis, which weakens the heart's pumping capacity and, if undetected, can progress to heart failure or dangerous rhythm disturbances, even in young and previously healthy individuals. This inflammation can also cause microvascular damage, forming tiny clots within the coronary arteries that reduce blood flow to the heart and significantly increase the risk of heart attack and stroke in the weeks following recovery, which explains why doctors around the world have reported sudden cardiac arrests in patients who seem to be doing fine after COVID. One of the most alarming aspects is that these complications often present subtly. Patients may dismiss mild chest discomfort, palpitations, or shortness of breath as mere fatigue or anxiety, when in reality, these can be early warning signs of myocarditis, arrhythmias, or even silent heart attacks, breathlessness on minimal exertion, an unusually fast heart rate, swelling in the legs, or unexplained fatigue post-COVID are red flags that warrant immediate medical evaluation. What makes this issue even more complex is the phenomenon of long COVID, where symptoms persist for weeks or months, affecting not just the heart but also the lungs, brain, and immune system, creating a vicious cycle of inflammation and stress that can overload the cardiovascular system. Risk factors such as pre-existing diabetes, hypertension, obesity, and smoking amplify these dangers. But even individuals with no prior history of heart disease have reported post-COVID complications, indicating that the virus can create new vulnerabilities. Now, the question is, what can you do to protect your heart after COVID? The first step is not to ignore any symptom. If you experience chest tightness, dizziness, irregular heartbeat, or severe fatigue, consult a cardiologist without delay, and if advised, undergo basic investigations like ECG, echocardiogram, or cardiac MRI to rule out inflammation or structural damage. Second, return to physical activity gradually. Many people make the mistake of resuming intense workouts immediately after recovery, which can strain an already inflamed heart and lead to sudden collapse. So start with light walking, listen to your body, and only progress under medical guidance. Third, prioritize anti-inflammatory nutrition. Include foods rich in omega-3 fatty acids like flax seeds, walnuts, and fatty fish, antioxidants from colorful fruits and vegetables, and whole grains to combat residual inflammation while avoiding processed foods, trans fats, and excess sugar that can aggravate vascular damage. Hydration is critical because COVID-related clotting risk persists for weeks, and dehydration can further increase blood viscosity. So drink adequate water throughout the day. Monitor your blood pressure and blood sugar regularly because fluctuations in these parameters are common post-COVID and can silently harm your heart. Ensure at least 7 to 8 hours of restorative sleep daily, as sleep deprivation worsens hormonal imbalances and increases cardiac stress. Avoid alcohol and smoking completely during recovery because these substances place additional strain on the heart. Another important aspect is mental health, as anxiety and stress post-COVID can elevate cortisol and adrenaline levels. increasing blood pressure and heart rate. Practices like deep breathing, meditation, or yoga can help restore autonomic balance. For individuals with severe COVID history or those who required ICU admission, a structured cardiac rehabilitation program under professional supervision can significantly improve recovery outcomes and reduce long-term complications. Remember, the risk window does not close immediately after testing negative for COVID, as studies have documented cardiac issues emerging even 3 to 6 months later, making regular follow-ups crucial. Lastly, educate your family and community that COVID is not merely a respiratory illness but a multi-system condition that can damage the heart silently, and encourage them to take preventive steps such as vaccination, early treatment of infections, and proactive cardiac screening if they have had COVID. Ultimately, safeguarding your heart after COVID is about vigilance, lifestyle discipline, and timely medical intervention, because ignoring these signals can turn recovery into a life-threatening setback, whereas addressing them early can help you regain not just your health but your confidence in living life fully and heart-strong.